and we're looking at the differences in their behaviour in a way that's practical and effective. I'm Dr Meredith Sheil. I originally trained as a paediatrician and worked for many years as a paediatrician. In the latter part of my career, I moved more into medical research. And in that capacity, I spent a lot of time investigating the outcome of children having open heart surgery. So fairly intensive medicine and intensive research. I'm also a wool grower. My husband and I have a sheep property in the Central Tablelands of New South Wales where we raise around 2,000 superfine merino sheep. Not long after Matt and I bought the sheep property, I became aware that lambs undergo surgical procedures as a routine, which is often done to protect their health, such as the mule's operation and tail docking, and other procedures such as castration, which are required for management reasons. And I guess what astounded me, coming from my paediatric background, was that these procedures were done without any form of pain relief, and perhaps even more astounding was that there just didn't seem to be any products or medications available that were practical and safe and effective to use for sheep. Although we have very effective analgesics and pain relief treatments for human surgery and companion animals, much of the way that we deliver those medications and treatments is just completely impractical for use on farm. What was required was, a lot of lateral thinking to think about how we could take the medications that we know are effective and transform them or develop products that would be safe and effective and affordable for farmers to use for the sort of procedures that sheep, for example, undergo. We've been really encouraged with the results from the trials that we did with the topical anaesthetic agent, which is now called Tri-Solfen. It's a combination product, so it not only has local anaesthetics in it, but also adrenaline, which is to stop bleeding, and an antiseptic, which is to prevent infection. So the combination works on a wound, any open wound, to immediately numb it, alleviate the pain, and also treat the wound itself. When we started to try and develop pain relief for the mulesing procedure, there was a lot of scepticism, I think. I often got comments, no one will use it, or it won't work, or it won't be good enough. I've just been astounded by the way, we have been able to come up with a product, it does work, and I've been astounded by the way farmers have just instantly taken to it. I think as soon as they see the difference in their sheep, it's something that just becomes second nature to what they do, is to use pain relief.